welcome back to What Did You Learn? I'm your host, Ahava Leaptag, and I'm really excited today to introduce my colleague, Sarah Sanders, who is the Senior Vice President and Chief Marketing Officer of Nemours Children's Health. Welcome, Sarah.
Thank you, Ahava. I'm so happy to be here. Thanks for the invitation.
Absolutely. It's great to have you. So it's been 7,000 years.
Longer, 10,000 years.
10,000 years. We've already evolved into a different kind of creature, a home creature. And yeah, you're right in the center of like a massive, unprecedented situation. So what hobbies did you learn?
What hobbies? Well, I started out like puzzling like crazy. Like can't tell you how many 1,000-piece puzzles we went through. And then one day I sat down in front of a puzzle and I haven't looked at it since. It's got like 3 pieces connected. I just got puzzled out. So we definitely, for a couple of months, and I was sending them to my brother, both my brother's families, and they were doing the puzzles. There was a time that you couldn't order puzzles online. Right. It was crazy.
That's right.
So I definitely did a lot of puzzling. And then because I was stuck inside, because of COVID, and during the summer in Florida, I did a lot of swimming. Those were my 2 things that I did because
that sounds really great.
Heat, but I had to get out of the house.
So let's talk about this. So you're at a massive children's health system, and this thing explodes, and nobody really knows what's going on with kids yet. What were the first few things that you said to yourself, I better get a handle on this immediately, or this thing's going to go out of control and I'm never going to be able to get out ahead of it?
Well, we, very quickly made the decision to really shut down clinical operations. So that was really the first step. It was just closing down the in-person visits and even limiting exposure on the inpatient side. So it was really, from a health system perspective, how do we shut it down, but still give our patients and families good access to the care that they need. So fortunately, we had a really strong, going into this, like 5 years of building up a really strong telehealth infrastructure. So that allowed us to really switch on the dime. It wasn't until maybe the MISC-C, which is the version of COVID that hits kids.
Yeah.
It probably was 6 or 7 weeks into the virus until we really started knowing that it did affect children. Most children are asymptomatic, but some have very severe reactions. And it was sort of this mystery disease. Kids were showing up with weird rashes and trouble breathing. And so we rapidly tried to, we actually had a couple of cases, and our cardiology specialists were able to really speak to MISC-C, and we actually got a lot of national interest and national placements, CNN, et cetera. We were on the nightly news right during that time where these cases had been identified, and they were trying to figure out what it was. So I'd say that was the first big one that we were like, we need to figure out what this is and get sort of our specialists organized around to speak to what it is, and then share it with our referring physician communities as well as our patients and families.
Yeah, it's interesting. Just listening to you talk brought me back to that time period. And it's so interesting because I forgot how crazy it was. Like on a daily basis, we were just trying to figure out what we were dealing with. What was this thing? How did you catch it? And what also is sort of frightening to me at this point is that there's a lot of things we still really don't know, And I think we've gotten comfortable with just knowing we're not going to know everything.
Yeah. I think most recently what has really been, I think one of the most significant things for a pediatric health system is sending kids back to school and just not knowing what was going to happen, and not knowing, good parent, you don't want to put your child at risk. And yet all of us know after 5 or 6 months of our kids staying home that that's not healthy either. So I think from a pediatric perspective, what was really tricky was just sharing scientific knowledge, not making any judgments on families on either. That was some of the most contentious, like,
Oh my gosh.
parents kind of like, what, you're sending your kids back to school? What, you're keeping your kid, like it was amazing, those, parent boards and things that were having conversations. And it was just this huge flashpoint of a judgment, your
Yeah.
decision on either side. So as a health system, we really had to just focus on what the facts were, focus on the science.
So what do you, and speaking of a confusing time, if somebody had come to you in December and said, Sarah, you've got to get ready for this, what do you wish that person had told you? What do you wish you had known?
Amazingly enough, I think about that time period, and we really describe it as this time period of two pandemics. I think we were able to very quickly work through the COVID piece because we had good collaboration and infrastructure in place. And it was amazing the amount of teamwork across the organization that went into that period. But when the second pandemic, in other words, the pandemic of social injustice hit, I think that one actually caught us off guard a little bit more from my perspective, in that, we hadn't really worked through what we would say about social injustice or social causes. And then it was actually a perfect storm for us because we were just in the midst of redoing our strategic plan, our 5-year strategic plan, when COVID hit. And so our long-term vision is really about transforming children's health, about addressing social determinants of health, and certainly health inequities amongst that, which just became so vibrant and a flashpoint during this COVID pandemic. But we hadn't finished working through that. And so when, we were sort of this, I don't know, maybe conservative organization in the past, where we were very careful about what we said about what things. And we were quickly transforming into this organization that says, no, we got to take a stand. We got to say more. We got to do more. But we hadn't quite worked out what it was. I wish I had known that before it started. I really wish I had known that we really needed to be able to speak about that.
One of the questions that I've been asking almost everybody is, how did you deal with the Black Lives Matter? And everybody sort of came back and said that was the hardest time. Mm-hmm. That the pandemic, and then just that issue, and people talked about dealing with internal employees and how they reacted to it and hearing their stories, and then also trying to figure out how to respond and how to sharpen the message and really say something. And I know that somebody watching it, what I saw was that almost like the pandemic had prepared companies that when they said nothing when the pandemic first started, and they just sent out emails and they didn't really say anything that was of value to anybody, when that social stuff hit, they actually did come out and say things that matter. They sort of were much more, I don't want to say aggressive, but assertive in their communication. And it's interesting to hear you describe, in a very large organization across a massive geographic area, how you get on it. Like, how do you create cohesive messaging? Because there's so many different points of view, and I could see how that would be very, very challenging. So, as a communications perspective and somebody with, real expertise in that area, what did you do to sort of coalesce those communications? And did you have to do a lot of sort of massaging, or was there, where did you take your cues from leadership? Where did you take your cues from your employees?
Yeah, I think both, everything, you know what I mean? We kind of did what made sense, but then I think what happened was, we put out a supportive statement, and our CEO came out with a very lovely message. But then, there were some in our organization that said that went too far, and some that said that didn't go far enough. So I think what it triggered really was more of a, well, what's next? And we found, as we were working in our strategic planning process, establishing a new vision for the organization, that a lot of that informed the language and the initiatives that we built into our strategic plan. And so in day one, did we have it all figured out? No, but it certainly influenced where we were going in the future. So it was just almost perfect timing for how we were, even our brand values evolved from that time. We included an element of authenticity, which was not present previously, that really influenced our voice and how we talk to consumers. And so I think, you know, we didn't have it all worked out at the beginning, but it really triggered a lot of action throughout our organization to move forward in a place where I think we'd have much better system-wide approach. What happened was we actually had a very advanced Office for Health Equity and Inclusion in our Delaware Valley infrastructure, but we didn't have as much of that in our Florida structure. So now that became system-wide. We added it as one of our pillars in our strategic plan. We included equity in our language there, and a lot of programs that had support of that. So we did what made sense at the time, but we also didn't leave it, you know, that sense of putting your money where your mouth is.
Yeah.
We definitely, at all levels of the organization, would be much more prepared and better prepared to handle that moving forward, because we're living it now versus we were just maybe speaking it then.
So did your organization, though, at the ground level say we need to prepare communication directed towards children and families to help them work through these issues? Or was it mostly on the strategic side of the business that you were really focusing your time and your energy?
You know, we did both. We have this great resource that hopefully you all know out there. It's called Kids Health. They do a great job of explaining anything that a kid would have a question about. And so they really, they try to address what's in the mind of a kid and try to answer those questions. So we certainly, within the children and family perspective, had that content created. We had a great
wait, and I just also want to say that the amazing thing about that site is that there's also for ages. So you can find how to talk to young children, but also how to talk to adolescents. And to me, with adolescents and a child, it was very helpful whenever I had to like have discussion points to go there, because my 17-year-old isn't going to react the same way that my 11-year-old is going to react, you know? So it's good to have that. And I think that that's a really important thing that, you know, we have to remember about pediatric health, which is that, you know, there's babies, there's toddlers, there's school-age children, and then there's these pre-adolescents, adolescents, and they're going through a lot of different growth spurts, and addressing them differently is really critical.
And they understand, you know, they understand things differently and have different questions. Yeah. We're really trying to be the voice of the child and try to live that. And as I was about to say, we have a great behavioral health program as well. And so they spoke and gave lots of external lectures about just the anxiety on top of COVID that this race situation, the racism situation, was causing to children. And it, you know, some of that is just heartbreaking to have to explain that. And gosh, kids should be so innocent and shouldn't have to know stuff. So
what do you think the main thing that you've learned is?
What I learned so clearly was the importance of trust between our organization and those that we serve. And that sounds funny because we just talked about all these big things, but trust at the core is about the relationship that we have. And so as a part of innovation, you know, we knew that we had these families to care for, and they weren't seeking care because they were too afraid. You know what I mean? So we had to message that a lot. Like, this is what we're doing to keep you safe. This is what we're doing to bring you the care that you need. You need to get the care that your children need, not only just in the moment, you know, urgent care, but the preventive care. We were very innovative in terms of how we created a program to give babies their vaccinations, you know, that they were missing them for several months.
Drive-through vaccinations for children are being given at this Nemours location in Media, Pennsylvania, where they're also conducting some visits in an outdoor tented area.
So any kind of element that we felt like couldn't wait, we found a way to bring that to the families. Just how to communicate with families. You know, we had just probably in the last year launched our CRM infrastructure with marketing automation capabilities. So again, stroke of luck actually that we had just done that, because we had to communicate with so many different, it allowed us to have very segmented data-driven communication strategies, so we could communicate differently to, families that had children with complex medical needs. We could, communicate to them by market, because we have different services in different market.
You were really lucky.
By age group, like as you just said, we were able to send out information to to families who had babies versus adult, so having all that in place, it was just like, I don't even think our organization really knew what we had invested in. So it really drove our data, our technology infrastructure forward from a marketing perspective, using all of that to really create these sticky relationships, I think is a part of innovation that we needed to just move forward because it was necessary, but it also engendered a great deal of trust between our families and our organization. So they trust us even more. I think we had that as a baseline, but I think that relationship as it relates to how we were able to handle that situation.
So you and I are at a conference in a year and a half from now, hopefully just a year, or I'm coming to Florida and going swimming with you. And we're sitting there, hopefully with a cocktail or two, or 3 or 4.
Yes.
I say to you, what's the one thing that you took away that, is always going to influence the way that you approach your leadership, your marketing style, how you work with your executive team across silos? Mm-hmm. What's that one thing that, really you got out of it more than anything else?
So I think, I've only been at Nemours for 2 years now. And so we've been working on a rebranding for our organization during that time. And what was really great was this was a good training ground or testing ground, I guess, for our new voice. And so we, when the pressure is on, you have to come out as a leader. And we definitely took on a new tone, a new voice. And what was exciting to me is that was something that we brought up from the communications perspective. We shut down we were not one of those hospitals that was filled to the brim with patients, that intense adult situation.
Yeah. Sarah, where can people find you?
You can find me on LinkedIn. I'm on LinkedIn.
Well, thank you so much for being here. I really do appreciate it. It was wonderful to have you.
Yeah, that was fun.